Well, good morning.
Good morning, Reverendville. How are you?
The doctor is in. For those who are fortunate enough to live in Southern California, or probably the West Coast, your reputation spreads to several states. Um, you've you've got quite a reputation in the energy healing community, um, not only for your wonderful treatments that you give people, but you also train people and you train healers and you train people that are involved in these healing arts, as I call them. Uh, you're one of the few out there to kind of mix science with the new age. Most new age people, it's like new age, right? But you got a PhD in clinical psychology. You got a master's in teaching, I believe, elementary, primary, and junior high levels teaching. So you're well qualified at that level, and you've done a lot of learning on your own. And having known you for this last few years, I realize that your learning's been that's been your curve. I mean, that's the road you're following. Every day is learning something. And so I wanted to share you with a greater audience because I'm impressed by what you're doing. And you have a website in case somebody wants to go to it. I'll have information down below with all your certificates and everything else you got going on your website and how to contact you if people want to get involved. And I believe you're going to be starting next year a year-long training program for people in the healing arts. So we can discuss that a little bit at the end. But I'm most curious about, and I think this audience that watches my videos would kind of like to know what happened 3, 4 years ago when you had an NDE. And that's where we're going to start. And then we work backwards where you started life. But I think this is an interesting topic because it's kind of made the you that's present today. It's amplified your desire to heal, your desire to train people, your desire to be a part of the spirit and science and and the greater community. So I think it's been a real catalyst for you. Anyway, explain to us what happened. Uh, you were just minding your own business and something happened, boom, there you are. So let's talk about this mystical, magical near-death experience you had.
Yes, thank you so much, Reverend Bell, for your sweet introduction. And yes, so about 3 years ago in February, I was scheduled to have sinus surgery because prior to that, for 6 years, I was dealing with this very excruciating pain in my head and brain and all up and down the left side of my body. And some people were calling it the suicide disease, trigeminal neuralgia. Some doctors didn't know what it was, but I had a lot of doctors tell me, oh, a lot of people just kill themselves when they have this. So just, or we can poke a hole in the back of your brain and put a sponge between your nerve and artery and fix it. And I was like, no, thank you. No, thank you. So when this doctor said we can do a sinus surgery just to open up, the air bubbles in your face, I was like, okay, let's try that. So we did the sinus surgery, and then right before the surgery, before I was going into the surgery room, I had a really bad feeling. You know, those feelings that all of us get when something is wrong. And I just remember praying to God and Krishna, Christ, God, whatever. I was just like, please hold my hand during the surgery. And whatever is about to happen, allow me to use it to be of service to humanity. That was a prayer somebody had taught me a long time ago, if you're ever in trouble, to say. So I said that prayer, went into the surgery room, and when I came out, I was in so much pain. And I just remember thinking, this pain seems like abnormal for him just doing a little bit of a cut in my sinus bubbles. But I went home and my sister came with me for a few hours and then I was just kind of alone. And for a few days, I just did not feel good. My brain was swollen, my face was swollen, and I sneezed, I think 3 or 4 days when I was in the house and I felt something just crack, like it felt like something going, eh, and I fell to the floor and I managed to somehow like grab the phone in my hand and I just called my mom and I said, please come. I think I'm dying because the pain was that bad. I couldn't even get off the floor. So my sister came and she took me to the ER and it didn't look like anything was wrong. So at first they were just kind of like, everything is fine. But then we told them I just had sinus surgery. So then the doctor's like, oh, that's weird. Like, let's do a CAT scan with the dye and the And then when they did it, they saw there was all these air bubbles in my cranium, and I was having a CSF leak. So all the liquids were coming out of my brain for a few days when I was at home. And so then they transferred me to another hospital where I had the surgery, which was really not a good hospital. And I was in the ICU for, I think, 5 or 6 days. And when I was there, I was kind of like going in and out of consciousness. And at some point, I crossed over to the other side. And when I went to the other side, I saw this like beautiful heavenly world. I saw all these what looked like gods or angels like dancing on mountaintops, and everybody was so happy. And I remember hearing like the voice of God, which was the voice I had heard my whole life, but I didn't know it was God. And I heard God say, like, I know you've been through so much, and if you want to come home, you can. And I just remember thinking, like, yeah, I really want to come home. Like, this place is amazing, you know? But then God said, but if you go back, you'll be able to help them with what is to come. And I kind of had a feeling of what she was saying because I knew there was a lot of trouble coming for humanity, right? And so I thought about it for a few seconds and then I was like, no, I got to go back. Like, I can't just abandon my family and everybody that needs my help, my animals. And so I remember I kind of came back into the hospital room. Suddenly I was back in the room. All the alarms were going off, you know, and I also remember God saying, like, after you go back, you're not going to be healthy right away. Like, you're still going to have to work to get healthy because you were already sick before the surgery. And now that they've cracked your head, you're going to have all these other issues, basically. So that was the near-death experience, right, Bo, and kind of what happened.
Wow. All right. So let me ask a question that most people always want to know. This moment when you leave your physical self, that's the best way to describe it, and you find yourself someplace else, some time place else, some other sphere, some other dimension. And is there a break between your consciousness at all? Is it a smooth connection? How does that work? How'd that work for you?
Yeah, it felt like it almost felt like I was just going into a vision suddenly. Like, you know, I'd meditated before and I'd had visions of angels and things like that. So it felt very seamless. It didn't feel like anything abrupt. It just felt like suddenly I was somewhere else, like not in the hospital room. All the noises were gone, you know? And it seemed like, yep, suddenly I was just in this other world, is what it looked like. Like I kind of appeared there. Um, yeah.
Did did you have anybody that you discussed this with, or was this something you kept private for a while?
I kept it private for a long time because I didn't even know this was a near-death experience. And it wasn't until I saw, you know, one of my doctor, Dr. Kim, and he was kind of like, you had a near-death experience. And I was like, did I? I didn't even know that because I never read up too much about them, you know? So I just kind of thought, oh, I talk to God like I usually do. And this was just a little more dramatic because it was in the emergency ICU, ICU, you know? So, but my personality changed after and a lot of my memories. So that's when I was kind of like, okay, maybe there's been a shift in me because I feel so different now, you know?
Yeah, I hear that from a lot of people that had near-death experience. It's like a spiritual rebirth.
Mhm. Yeah, I felt like a little kid again, which was the interesting point because I'd been through a lot of challenges in my life. So I kind of had this like heaviness with me. And I remember after the near-death experience, I felt like a little kid, like I was giggling all the time. And I was like, this is strange. Like I'm giggling all the time. All the challenges are there. The pain is there, but somehow there's this new gift. And I felt like that was the gift that God gave me was like, he brought my joy back. I was like giggling again, you know? So that was really nice. I was up, I'm 3 years old because I died in 2022 and now it's 2025. So yeah,
Okay, so you having your 3-year-old spiritual birthday.
exactly. Yeah.
All right. So take us back to the beginning because everybody has a beginning. Even the doctor, you got a beginning. And what I have found, and maybe that's not the case with you, but I have found the people that I'm working with, who I consider very energy sensitive, spiritually attuned, uh, more on the enlightened side. everybody has a terrible childhood physically or mentally or all kinds of, it's not an easy road. I got a suspicion that life wasn't all easy for you growing up.
No, no, it definitely wasn't because from the beginning, I had a lot of health challenges right away. I had rheumatic fever as a kid and I couldn't move the part of my body, so I almost couldn't start first grade. Then they put me on, penicillin for 10 years. I would have to get these painful shots every single month. And I remember that's when I started reading because every time I got a shot, my mom would buy me two books. So it's kind of like that's when I got into reading books. And then I had kidney stones, a bunch of times. And then I got dental surgeries and then this trigeminal neuralgia. So that was kind of like the health stuff. But as far as trauma, I also had some traumas, like most of us do, like various kinds of trauma starting as early as the age of 4. But I think like God had me do this because she wanted me to become a healer, So I kind of had to have experience of everything, like the physical traumas, the medical traumas, the other kinds of traumas, so that when people came to me, I wasn't just reading from like a book. I would be able to say, oh yeah, I've had pain where you can't sleep, or I've been hit before, or I've had this kind of trauma or abuse. So it made me like an actual healer versus just like a book healer. I think that's why God does it, because sometimes people say, well, if God is so loving, why does God allow us to go through these things? And when I asked God, God said, it was because you asked me to let you go through those things so you could get like a good internship, basically. So,
There we go. So let's go back to the spirit and science thing because it seems to be kind of the theme of your life. It's kind of like two sides of the same coin. It's like you were more of a, in the beginning of life, I think you were more into the science and balance and, logic and evidential things to prove things. And I think now you're kind of evenly split between intuition, intuitive energy healing, and the other kind of healing. Does that make sense? Is that correct?
yes, absolutely, you're correct. Because yeah, when I went to my schooling, it was all traditional, right? A lot of research, a lot of papers. Got my PhD, we have to write these long papers, right, to prove the existence of something. But then I just kept seeing that there was all these missing things, like science has a very interesting way of studying things and it leaves a lot of things out. And when I would work with clients that science would consider them crazy, when I would talk to them, I'm like, they're not crazy at all. They're really talking to angels. Like they're because they were coherent, they had a job, they had a family, they were paying their bills, and they saw angels. But in like the psychology book, they would say, oh, if somebody sees angels, they have delusions, they're schizophrenic. And I was like, this person is living a completely fine life and they're seeing angels. So that doesn't connect. So I realized that science was limited. And science is relatively new, right? Like they've only been studying these phenomena for maybe 100 years, but spirituality has been around forever. So when I got into the spiritual text of the various kinds, I was like, wow, they have an explanation for all these things that science is missing, like, cities or powers that yogic people talk about, right? That if you meditate, different parts of your brain will kind of activate. And so that's when I kind of found, and I was like, okay, this is very interesting. And I started to believe people. So when my clients came in, I would be like, you are seeing things, so let's develop this gift better so you can use it in your work or in your day-to-day life.
Well, that must be kind of surprising for some of your people coming to you because when they've gone for help, they're treated like they got a mental issue. Uh, and then when they go to you and you're going, oh, yeah, that's spiritually inclined, that's an energetic thing. That's angels are real. Um, so I'm assuming that in your treatment, you're getting people that have angel issues. I'm assuming that you've had people with near-death experiences come to you. And from looking at your stuff and from your teaching credentials, I would assume that a big workload also is young people, teenagers and youngsters. Uh, can you talk about that a little bit?
Yeah, absolutely. Seems to be people that are spiritually oriented. They're into holistic stuff. Like, yeah, people of all ages. My youngest client was maybe 3 years old, and she could see goddesses in the backyard. So I would meditate with her. I would go to her house and do sessions with her. And she had anxiety in school, so we would just focus doing meditation. And then I've had a client that was maybe 85 years old and he was getting ready to pass. and he was so scared of death. So I had to kind of prepare him, like when you pass, you're going to see beautiful things. So yeah, people usually it's usually people that are spiritual that want to go beyond traditional psychology of just getting a diagnosis, but like instead coming into their higher self embodiment. So we're kind of doing things to remove whatever is getting in the way of them being their higher self, whether it's a trauma or something like a belief about themselves or something like that. And then also getting them into their Dharma, because a lot of people that come to me, they're not in their Dharma, they're working for corporate or they're doing something that's not feeding their heart. So I'm like, okay, how can we get you back into the path that God intended for you? That kind of stuff too.
So you sound like now you've actually found your Dharma, your own Dharma.
Mhm.
And how long have you realized that at what age did you start to realize that maybe this is really something that you're destined to do, supposed to do, should do, your mission in life? When did that kind of dawn on you?
I would say like it came to me slowly, to be honest, because I remember being in my 20s and talking to people and getting them to switch careers. Like I remember a friend wanted to go to law school, but I could see visions of her being a chef. And I was like, I think you're meant to be a chef. And then she ended up switching and now she's super successful in Hollywood and does like a catering for all of them and makes all these amazing foods. So that was just little intuitive hunches. But then when I finished school or like even when I was in the clinics, when people would come to me, I would always be like, like this relationship they're in doesn't seem like it's the right one for them, or this career path they're in, it's not the right one, or their whole life they've been psychic and they've been suppressing it. Like we need to develop that because they can bring it into their medical practice and it'll make them a better doctor. So it's kind of like I call myself like a mechanic, like an energy mechanic, because I'm just like, oh, there's like a little block here we got to remove. And so it kind of came slowly, but when I had my near-death experience 3 years ago, and I finally lost my doubt, because before that I thought I was hearing God, but my scientific mind was always like, what if you're just imagining this? Like, what if this is just wishful thinking? But when I crossed over and I heard that same voice and how loving it was, how supportive it was, I was like, oh my God, it is God. This whole time it's been God. And so ever since then, like I just listen to that voice all the time. Unless I'm like very emotional or having a hard day, obviously, right? Like that's when our intuition is not as accurate and we have to get grounded. But I would say most of the time I really trust that voice and it'll tell me things like, you should work with this person or this person you should send to someone else. And so I just follow the guidance.
So most healers focus on the body, some focus on the soul, some focus on the mind. I'm getting the drift here from you that this is a multifaceted healing. You're healing the holistic part of this soul. In other words, body, mind, and spirit. And can you address that a little bit and talk about the energy that's involved with this process?
Yes, of course. Like you know about this because you know so much about energy. But yeah, like when a problem occurs for someone physically, it first occurs in the energy body, which is on the outer layers of us. For example, if somebody's going to have cancer, we can look at their aura a few years before and there'll be a brown dot where the cancer is going to occur, right? So when I see people, I'm able to see, oh my God, there's something around their eyes. And then I might ask them questions and they might tell me, oh, yeah, I've had cataract surgery before. So without them even telling me, I'm seeing in their aura there's blockages. So when I help them to balance their energy, I think it is going to in the future prevent possibly physical things from occurring. We can't say that because I'm not a medical doctor, but spirituality and body are so connected, right? And then like their emotions as well. Like if they come to me and I see one of their emotions is very intense, I can tell one of their chakras out of balance. And different emotions can create different physical illnesses, right? Like thyroid is like from worry, or liver issues is from anger, right? And like breast cancer is usually from overgiving or not receiving enough, that kind of stuff. So by kind of like addressing this emotional and energetic aspects, then yeah, the mind, body, and the soul are healing. And then I'm always connecting them to God. Like every session, I'm always praying with my clients, and we're always bringing God in, and we're saying God is the only healer in the universe, and we're just allowing God's energy to come in. Because I'm not healing them, like I realized a long time ago, I'm not the healer. Because if I was the healer, then every person that came to me would get the same results, but that's not what happens. Some people get healed, some people's situations get more intensified. Some people don't even connect. So it's God doing the healing, and I just kind of surrender 100% to that. And so yeah, that's kind of what I've noticed.
Wow. I I've had the luxury and the privilege to get to know you early in the game here, and I know that you've been working with people in dealing with things like stroke, and now it's kind of hit home this last year. Your father. Um, Seems to me that when this happened, you've done a lot of research on stroke victims and cures or treatments and stuff. Would you like to reflect a little bit on that? Because I know actually a couple people that are going to be watching this video who have had people in their family have strokes. Kind of take us through that process because you're as a daughter, your father had a stroke, and you're dealing with this now. What have you found out? What is it that you can gift somebody else with your knowledge? Because you've done a lot of research on this.
Yes, I'm kind of like, I'm very obsessive when I have to solve a problem. So I've been, yes, exactly. The last 10 months, I've been researching stroke inside out, like the physical aspect, the emotional aspect, the energetic aspect. And my dad, lost his ability to talk, eat, and walk suddenly. One morning, he just woke up and he was totally healthy before. So I was just like, how can this happen? Right? So from an emotional perspective, when someone has a stroke, it's because they're just tired. Like life has been coming at them for so long, and it's kind of like they need a break. And my dad was that kind of a guy where he would just kind of hold things in and just kind of try to keep the peace. So from an emotional perspective, it seems like it's people that hold things in and then suddenly something kind of like goes haywire. From a physical perspective, like in Western medicine, they don't have a cure for a stroke. So my dad was in the hospital. They put a tube in his nose right away and his stomach, like within the first 2 weeks. And they just basically told us this is as good as he's going to get, basically. That's what all the doctors were telling us. I just remember thinking like, no, people can heal from anything. It's just a blood vessel that's, stopped working. And so, in terms of energy healing, I would do energy healing on the person that's had the stroke and open up their blood vessels or take into someone that can kind of reset their blood rhythm and their blood pressure. And then there's all these new treatments like exosomes and stem cells that can actually rebuild the brain and rebuild the body. And insurance doesn't cover it because, insurance doesn't make money if somebody gets cured, but you can do your own research. So we're doing things like that for that. Acupuncture is very important because you can do scalp acupuncture on the brain and actually activate the parts of the brain that are impacted. Obviously, physical therapy, speech therapy, things like that, but you have to do it with them all the time and just keeping him really positive. So like when I talk to my dad, I tell him, you're gonna get better. You're gonna get better. I don't tell him like, oh, you're stuck like this and kind of like, so not fake positive thinking, but just kind of telling him you're gonna get better. And then I show him videos or movies about martial arts because that's what he is. He's a martial artist. So I'm trying to kind of remind him of who he is because it also seems almost like a stroke. It's almost like they're in a nightmare, like they're kind of caught up in like a part of themselves and they can't get out. So I'm hoping that by him seeing images of himself as a martial artist and then we doing all this different stuff and also giving him a lot of herbal remedies, like spirulina, a moringa, really good fish oil, things like that. We're kind of giving his body strength. So hopefully over time it'll be able to rebuild itself. And so yeah, I would definitely, if somebody you love has had a stroke, don't listen to what Western medicine said that they're just going to be stuck. Like keep doing everything and just kind of, I see it like I'm pushing him up the mountain and I feel like he's going to make it because that's what God tells me. Like be patient, it's going to take time, but just kind of keep going. So, yeah.
Yeah, it's from a personal point of view, I'm saying it's hard to work on the healing process on somebody that's really close to you. It's, it's because there's that emotional,
Totally.
yeah, it's a closeness that,
Like surgeons never operate on their own families, right? Like
yeah,
exactly.
yeah, exactly. And it's like we have a hard enough time healing ourselves.
Yes, that's I'm so grateful for you and everyone else that's been sending healing to dad because exactly it's like I love him so much and like when we're healing someone we have to be so neutral when we're doing the energy healing work, right? Like completely neutral and let the energy come through. But with dad it's like I'm worried about him so that kind of messes with the energy work. So I've had all of our community sending him healing. And I think that's been helping.
Just as a little side note, because I thought it was interesting at the time. Uh, about a week before his stroke, he gifted you a plastic instruction cards on how to do reflexology. Now you're in the healing business. You didn't, you know, you don't need these things, but he gifted you that. He gives you this, and then when he had the stroke, what's the advice I gave you? Not even knowing that. What's the advice I gave you?
You literally said that. You said, Pantea, you got to work and do reflexology on his feet. Like you said that right away. I remember because we called you from the hospital, Dr. Kim and I, and you said, yep, Pontea reflexology. And then I was like, what? Like he just gave me a reflexology chart right before his stroke. So then that made me think like, wow, maybe dad knew this was coming and Reverend Bill intercepted the message. And so everything felt more like something bigger is maybe happening here. Wow. It was, yeah, crazy.
There's no accidents in the universe, and you know when you're what's the word I'm looking for? When you're young and you question things still, uh, and you get thoughts and intuitions, and you don't say something or you don't do something because you go, well, and then as you get older and you discover that no, that's something I need to set for. Don't question it anymore, and you just present it. I noticed the change in you in the last year or two. Uh, you're more inclined to listen to your own voice than necessarily because I know you're getting different voices on how to treat your father, and you're now learning to listen to your own higher voice. How's that working out for you?
Yeah, wow, that's such a great point you brought up. Yeah, I think I'm less influenced now because I noticed when I was listening to other people, something bad would happen to him, or I would want to do something and then they would tell me, no, don't do that. And they would give me all the reasons and then I wouldn't do it and something bad would happen to him. So I'm like, no, I have to just go to my own voice right now. And then like if there's people, like the few people around me that I know are connected to God, like when they speak, I listen to them. But there's not too many people that have this 100% direct connection to God very clear, right? So yeah, I think that's doing better because even this medicine we just got him, so many people were against me getting this medicine because it was expensive and we had to raise money for it. And we're still raising money for it to do the rest of the treatment. But my voice was saying, You have to do this treatment." Like it's like one of the most important things you do. So I just followed it and it was a big risk, but he already looks better. 4 days after taking it, his skin is already looking like it has more life force. And he's been like talking more and telling me to clean the backyard. So I know he's kind of getting he's getting energy, which is a good sign because he's very organized. So
Yeah, your father's a genuine macho man. I
mhm.
mean, you talk about being a fighter. He is a fighter. The whole thing is he just needs to reawaken that fighter within him. And I think you're on the right track. All right, so let's talk a little bit about your practice
Mhm.
because you deal with um, energy healing. I'm assuming Reiki and other forms of, let's start with that. Reiki and other forms of energy healing. What are you actually talking about when you're talking about energy healing for people coming to you?
Yeah, like I started with Reiki. That was the first one I learned. And then I took like pranic healing, pranic psychotherapy, which are like other forms of energy healing. And then I took these energy clearing certifications, which is where I learned to work with lower energies, removing big, dark energies, that kind of stuff. And then this last year, I took a soul detective training with Dr. Barbara and Dr. Alcorn, which is also just, ancestral healing, like if there's a spirit attached to you, a couple past life issues. And so it kind of went really, really deep into like all the different levels that energy can be blocked in, right? Because Reiki is kind of like we're just starting. I call Reiki kind of just like it's like a tune-up. You're just kind of getting taking a shower. But then when people come to me and they're very spiritual, and then there's something in their life still blocked, we have to go and do detective work to find like, where is this block coming? And then we'll see sometimes, oh, 2000 years ago, one of their ancestors was killed and their ghost is still stuck. So we have to go help that ghost move on. And then it'll kind of help everybody and the ancestors move on. So it's kind of more like surgery. It's very specific, and finding the little blockages that make such a huge difference. Or I had one client that was sacrificed as a child many thousands of years ago, so we had to go remove it, but they were still as an adult today living like a very sacrificial life. And it's because the karma of being sacrificed as a baby was still kind of in their field. So that's kind of like the energetic aspects of it. But I also do like a timeline with people of their life when they come to see me from the beginning of their life till now. And I'm looking at all the significant, either really positive or really negative things that happen to them, because some of them leave an, imprint energetically, spiritually. I'm not talking about therapy, like talking about it and they're a victim. It's more like, let's go remove the blocks energetically so that they can have their full self back, basically. Because every time something bad happens to us, right? Like it's kind of like a part of our energy gets stuck. And then that's why people feel so tired, because they don't have their full energy right now. So stuff like that. And then yeah. And then helping them just to have peace as much as they can with the people around them, whether it's like their family or their loved ones. Some people we can make peace with, some people we just need to have boundaries and kind of just give them space. And so a lot of that kind of soul work too. So we're clearing the karma with the people in our lives. So we don't have to come back and live it again, right? So
So I noticed that you also treat PTSD. I'm assuming not just veterans. You're talking about people that have been raped or survived a crime, or they've been in a car accident or an illness. There's a lot of ways to have post-traumatic stress.
mhm.
Uh, what kind of therapy do you give them? Or do you give them therapy, or what do you do with them?
Yeah, it's more like I would say I do like I coach them, and I do like spiritual psychology with them, and I do energy work with them. So like with traditional therapy, they do very specific things with PTSD. For me, it's usually people that have already done some work on it, so they're ready to go deeper. So they've already kind of gone over the shock, and so it's more like we want to go back and remove the memories, for example. So we can do that with energy psychology. We can literally go back to the time that it happened, bring the angels and God in, and we actually delete it. So then I had a lady in my office last week that she had been raped when she was like, maybe like I think she said 12. And every time she heard this guy's name, she would kind of like convulse. And so we just did one session on it where we energetically and spiritually with the angels and God removed this sensitivity to this name. And she texted me back the next day, I think 2 days after, and she's like, Pontea, I say his name all the time and I feel completely neutral. So I'm just trying to bring them back to neutrality about it, not like numbness, which is nothingness, or over extreme, more just being neutral. Like, yes, this horrible thing happened to me, but I'm able to move on. And then I give them the purpose, which is the message I get from God with them, which God told me, yes, she's meant to go become a healer now. That's why she went through this painful thing. Because she kept telling me, like, oh my God, why did this happen to me? And I was like, I know, sweetheart, it doesn't mean God abandoned you. It's because you went through this so that you can be a healer. And I can't say that generally to everybody because that would be kind of mean to say, right? To people that go through physical trauma. Myself, I had to come to all these understandings over time, but she was ready for it. So that's why I told her. Some people, it takes longer for them to hear that the purpose of something painful is usually connected to our Dharma, right? So yeah, PTSD, yeah, for kids, for adults, for men, for women, because men also their PTSD is different, right? Because they don't talk about it. They kind of suppress it. And so I almost have to like look at their body language when we're talking. A lot of them will yawn sometimes. And I'm like, oh, they're releasing a trauma, when they're yawning as we're talking about it. So stuff like that. I would say it's like 50-50. My clients right now, 50% women and 50% men. And usually really like sweetheart people come to me. I tend to attract people that want to help humanity, but they just have some blockages that they have to kind of get over in themselves to be able to do that.
Do you do couples therapy as well?
Yeah, I do couple energy balancing sessions. Yeah. I had a couple come to me, and yeah, like whatever is causing the block in their life, we'll kind of talk about it a little bit so we're clear, and then we do energy work. And sometimes I have them like put their hand on each other's hearts, to kind of clear that block, or have them do like eye exercises to kind of help them reconnect after something sad has happened. I've had a few couples come to me when they were on the verge of breakup, and we were able to kind of like bring them back together. I was like, you guys love each other. And some of them, obviously, they're on the verge of breakup and they're meant to go be with other people. And I've seen that too, where they break up and then I see the two of them meet really amazing people that are more in aligned with their current selves.
Okay, as a teacher, as a healer, if you were treating this audience as your class, what's the best advice you could give them for coming to grips with all the stuff that's going on? Let's face facts. Let's just look at this weekend. This weekend, you had assassinations. You had Iran, and Israel going at it. I mean, people, that was terrible. You had Russia and Ukraine going at it. You had demonstrations across the country. It was overwhelmingly all over the place this weekend. How do people cope? What would you advise people? How do they cope on an individual basis or their family or whatever? What advice do you have?
I would say we're in a marathon. We're in a marathon, and in a marathon, you have to take stops, drink water, right? So you can kind of keep going. So imagine if we have the next 3, 10, 20 years, and there's going to be all kinds of chaos happening. So every single day we have to tune ourselves up. So like I will wake up in the morning, I have to do my self-care rituals, meditate, get myself centered, take the right nutrition, and just kind of bodily, mentally, emotionally be really solid when I start the day. And then as I'm going throughout my day, like I would take breaks. Like if I watch something on the news, like about Iran, for example, my cousins are calling me and telling me there's bombs outside our window. So I'm just like, oh my God. So I kind of send them some kind of a comforting text. I pray for them. And then I'm doing things in the middle of the day to come back, bring myself back to center. So I might stop at a park and meditate. I might go sit at the ocean on my lunch break, go to a meditation garden. I might read some of my spiritual books. So all the tools we've been using all of our lives, we have to use them more throughout the day just to kind of come back to center. But also, like I would say as a feminine practice, like if we feel like crying, we should cry, like not hold it in. Like if we feel sad for the world, it's okay, cry and get it out, and then kind of come back to your center because it's going to be emotional to see all these things, and we can't just kind of be numb about it. But I think a lot of people have the right tools, but when we go into an emergency, we stop taking care of ourselves, right? Like most people, when it's an emergency, we do less self-care. So we have to do that. And also like realizing maybe there is a greater plan. I think that's the only thing that's giving me peace right now is like my tremendous trust in God, that because I think God has our back. And I think that there's going to be interventions. And so I would also say that, like remembering that how God has always shown up for you, and then realizing it's going to show up for humanity the same way.
Okay. Thank you very much. I look forward to seeing you again next time in Southern California. A lot of people don't know this, but if they read my last poetry book, it was basically dedicated to you. Uh, and I appreciate that. It's always nice to have somebody appreciate my words.
Yes, I love your poetry book, and I would definitely recommend everybody get the book right there, Sacred Verses. It's such an amazing book, and I gifted it to one of the monks at SRF, and he loved it. Right when he opened it opened it to the poem Guru, and so he was very happy that there was poems like that in there. And all your books are great, and I just gifted another one of your books to one of the doctors that came to help Dad, and he was very excited to receive it. So thank you for all the work you do, Reverend Bill, and for helping everybody.
Well, thank you. Let's talk about you in the future, because I've kind of seen drafts of where you're going. You're leading to creating your own book, uh, which is going to be, I'm assuming, advice on mental, physical, and spiritual aspects of healing and energy and intersprinkled with your life. Can you just briefly talk about that? And when is that coming out? Is that next year? Year after?
Yeah, maybe next year, God willing, I have about like 40 pages in right now. But yes, it's going to be about like mind, body, emotional, spirit, and how to keep it balanced. And also all the prophecies about like right now, our time, like every religion seems to have a prophecy of changes coming for the world. So it has that to connect all of us as humanity, that we're one family. And then the roles we each have to play for those things to hopefully come true. So that's what the book is about. So hopefully it'll come out next year, maybe sooner. And then my training is going to start at the end of July on July 26th, I think. Yeah, July 26th, and it'll be one day a month. So if people are interested in learning the methods that I do, they can take that as well. So yeah.
And your website is?
soulradiancehealing.com. And then I also have a YouTube channel where I interview leaders that I believe are doing God's work on the planet. And that's called Hopeful Purpose with Dr. Pontea. And I've interviewed Reverend Bill and a lot of other wonderful people. So please go and check those out. Some great messages everybody has.
Well, thank you, Doctor. I'm looking forward to promoting your book when it comes out. We'll do another interview. And blessings and peace to you and your father. And I wish you the best. And thank you for interviewing today.
Thank you so much, Reverend Bill. So grateful for you. And I hope you have a beautiful day. And I'll talk to you soon.
Bye.
Bye bye.